I'm joined now by Republican Congressman Jim Jordan of Ohio, who is a member of the House Freedom Caucus. So, Congressman, what is your reaction to that Jimmy Kimmel monologue you just saw?
We do all agree on that, and the legislation makes sure that we have a safety net provision called a high-risk pool. We allocate $125 billion to the states to make sure they can take care of the very kind of situation that Mr. Kimmel was describing with his young son. So we all agree that that should be the case, but we also want to bring down premiums for middle-class families. And what the waiver option in the legislation does is allow those states to get that waiver and get rid of those regulations that are driving up the cost for middle-class families. The very cost that Senator Manchin was just talking about, $7,000 that they're paying for a $10,000 deductible for families, and they're paying in a year's time. If they can afford the premium, they can't afford the deductible. We want that to come down, as well as protect the very situation that Mr. Kimmel was talking about.
Congressman, Senator Manchin says he will not support the bill as it is in the House right now. If it does make it to the Senate, we should note that. And then also, on this high-risk pools notion and on pre-existing conditions, there's a lot of serious concern that your bill waters down protections for pre-existing conditions, and it comes from a lot of different places. Your conservative colleagues are saying this. This is coming from Representative Bill Long of Missouri. The American Medical Association says it's worried about it as well, saying although the MacArthur Amendment, the ban on pre-existing conditions remains intact, this assurance may be illusory, as health status underwriting could effectively make coverage completely unaffordable to people with pre-existing conditions. And that's not it, Congressman. The Kaiser Family Foundation says the same thing. How can you assure all those various sources that they are wrong and you are right?
You can read the bill. The four corners of the document. The four corners of the document itself says that specific line. Pre-existing condition is covered. It says we have $125 billion in the bill to help with this very situation. We set up high-risk pools, the safety net provision, and if you maintain continuous coverage, you can't be kicked off and you can't be charged at a higher rate when some serious illness happens to you or your family. So that's all there. But also what's in the bill is this idea that we have to repeal Obamacare. It's what we ran on. It's what the election in 2010, 2014, 2016 was about. And we have to get at those key regulations that are driving up the cost for everybody in the insurance market, driving up premiums for middle-class and working-class families. So we're trying to do both of those things, and we believe this legislation, while not full repeal, we have to be clear to the American people, this is not what we were elected to do, but it's a huge step in the right direction. Once it gets to the Senate, we'll do more work to make sure we can actually get to full repeal.
Congressman, is it something you have to do? I think the poll numbers show something like 17% of voters say they're confident in your plan, that they want that plan.
I kind of think we left an impression with the voters, Katie, that said we were going to repeal Obamacare. I know I did in the 4th District of Ohio. I think Republicans all over the country did. We've had 3 big elections where this was a central issue. So I do think that's what we have to do. This bill doesn't get there, as evidenced by the fact that we're giving states the waiver option to get rid of the key regulations. But it's a huge step in the right direction, and I hope it'll pass this week.
Can you guarantee your constituents that their health care will not be more expensive, period?
That's if Ohio is a state that gets the waiver, I do believe, and more importantly, care policy experts believe premiums will come down, but that's why we need the waiver. I would have liked to have done it here, but we don't have the votes for that. We're trying to get the votes for what the legislation in front of us now, which at least gives this waiver option to states.
So the White House yesterday said that you do have the votes. Our whip count shows that you are 2 votes short of losing this bill. Are you confident that you're going to get those 2 votes? There's a lot of undecideds out there.
Well, what I know is what the Freedom Caucus, when we came on board last week, we brought 20-some new votes new votes to the S column. So I know about that. We're working to talk with our colleagues and encouraging them to support it because we think it is a big step and a good step in the right direction. Did
the president's comments yesterday help or hurt the cause? After all, he told Bloomberg that the health care plan was not in its final form, that it has to be good for sick people.
Well, I think the president's just stating the facts that we, like you and I just had.
But he said it wasn't in its final form. Is it still being negotiated?
Not in the House. I mean, there's some negotiation, but it won't be in its final form until it goes to the Senate, maybe goes to a conference committee and winds up on his desk. I do think it's really close in the House.
Are you concerned that the Freedom Caucus is taking this bill so far to the right that it's going to be completely unwinnable for the Senate? I mean, the Senate's ultimately going to make this much more moderate. So why not make it more moderate before it even gets to the Senate?
We told the American people we were for repealing Obamacare.
Is it just about fulfilling a campaign promise, or is this about making health care better?
It's about doing what we said. We're supposed to do what we said during the campaign. Never forget what Obamacare brought us. All the misinformation that was used to pass this thing. Like your plan, keep your plan. Like your doctor, keep your doctor. Premiums will decline. Premiums will decline $2,500. Website's going to work. Website's secure. These co-ops are going to be wonderful. 18 of the 23 have already went bankrupt. All the false information we're getting, that's the context we're in. So, of course, we got to get rid of that. This doesn't fully do that, but it's a big step in the right direction.
Concern you that the majority of Americans want to keep Obamacare?
Say that again, Katie?
Does it concern you that the majority of Americans want to keep Obamacare?
What concerns me is what the voters elected us to do in 2010, 2014, and on November 8th, 2016, where this was a central issue of the campaign. Certainly the voters in the 4th District of Ohio know where I stand. That's what I'm trying to accomplish, is what I told them I was going to do.
Thank you very much, Congressman.